presented by Roseman University College of Dental Medicine in partnership with Cure for the Kids Foundation. We're coming to you live from the Summerlin campus here at Roseman University. On this final day of National Children's Dental Health Month, joining us are four very special guests to answer important questions on our children's dental health and why regular dental care is essential for their overall health. We're going to be talking from cavities to braces. We hope to answer all of your questions. Let's go ahead and kick things off by introducing our panel of dental experts. Over here to my far right, I have Dr. Michael Cottom, pediatric dentist and site director of Roseman Dental in Summerlin. He's also a clinical practice assistant professor. Next, we have Dr. Matthew Thacker, director of Roseman University College of Dental Medicine's Advanced Education and General Dentistry Residency Program, located at the university's Henderson campus. He is also a practicing dentist caring for patients at Roseman Dental in Henderson and Summerlin. And then moving over here to my left, we have Dr. Alice Chen, pediatric dentist caring for patients at Roseman Dental in Summerlin and Henderson. She also serves as a clinical practice faculty. And finally, we have Dr. Glenn Roberson, orthodontist, associate professor, and director of Roseman University College of Dental Medicine's Advanced Education in Orthodontic and Dentofacial Orthopedics Residency Program. It's a mouthful, but it's an orthodontic residency program, and that's at Roseman University's Henderson campus. Welcome everybody on Facebook. Now, for all of you joining us on Facebook, we welcome you to ask some questions in the chat, and we'll do our best to get them answered probably towards the end of this presentation. Let's kick things off with Dr. Alice Chen. The month of February was National Children's Dental Health Month. Obviously, it's the last day of February, so we're wrapping that month up to raise awareness of the need of dental care for America's youth. Dr. Chen, can you tell us why children's dental health is so important?
That is a great question, Jason. And dental decay, as a matter of fact, is the #1 most prevalent chronic childhood disease in the United States. Untreated dental pain is one of the leading causes why American children have to miss school. It is estimated that up to 17 million of kids in America have untreated dental disease. That, along with other dental healthcare issues, attribute to up to 51 million hours of missing school. So you can see dental problems is not just an issue for kids and their families, but it's also a burden for healthcare professionals and educators too.
Yeah. So to mitigate some of this, the tooth decay, how often should children be seeing the dentist?
Well, the American Academy of Pediatric Dentistry, we recommend all kids to start seeing a dentist no later than the age of 1, and it should be at least once every 6 months. For certain high-risk children or kids that have specific issues, we actually have a higher frequency. Sometimes we see kids every 3 or 4 months, really depending on their needs.
And what kind of treatment is provided at these, twice-a-year appointments to prevent the tooth decay, in addition to the normal brushing that they have to do?
So we take regular radiographs. X-rays are very, very important, and to diagnose not only cavities, but a lot of growth and development issues too. And of course, there are many parents who are scared of radiation. And as pediatric dentists, we actually follow a very, very strict guideline. We use good techniques, we use good protective measures, and we take very, very conservative x-rays, only the ones that we need to. Second, we do a really good dental cleaning. Even for younger kids, a lot of them can actually develop hard tartar calculus buildups at a very young age. So we have special instruments to remove that. And finally, dental fluoride treatments, fluoride gel that we paint professionally onto the teeth, as well as preventative sealants for the biting surfaces and molars. All these different modalities in combination all serve to maximize all the preventative measures that we can provide for kids of all ages.
Very good, thank you. As Dr. Chen shared, children's dental health is very important, and they do a lot to help prevent tooth decay. Dr. Thacker, What is the state of dental health among adults, and how does the attention of adults on dental health influence or impact children's dental health?
So that's a good question. And like Dr. Chen mentioned with some of the statistics of high prevalence of dental decay in children, oftentimes that kind of carries over into adulthood. And so 26% of adults in the United States have untreated dental decay on at least one tooth. And 46%, almost half of Americans over 30 have advanced periodontal disease, which is gum disease essentially. And so there's a lot of things that can be done at home to kind of instill good habits early on with children. You want to make sure that you're, brushing for them up until the age of 6 to 7 when they develop the manual dexterity to actually brush on their own. But even then, you want to make sure you're supervising them for until they're about 12, 13. You kind of see what they get themselves into with other things. God knows what it is with their teeth. So,
and obviously, parents going to the dentist regularly, twice a year, impacts children going to the dentist twice a year. So we have to encourage our parents to also go twice a year.
yeah, absolutely. And there's with that, it's kind of a unique aspect of our dental clinics in general in that we see adults and children at the same time. And you will find dentists out in the community that do have more of a family practice. However, it's a little bit far and few in between, and they're not accepting children usually that have any kind of behavioral modification needs. So coming to a clinic like ours, where we have both in-house, Dr. Chen and Dr. Cottom will be seeing the pediatric patients at the same time when I'll be seeing their parents, and it's worked out really well. It's opened up access to care quite a bit.
Very good. And that's actually a very good segue to Dr. Cottom. Roseman Dental in Summerlin is a highly specialized clinic serving a very specific patient population with special needs. Can you tell us about the clinic and its patients?
This is a really neat clinic here in Summerlin. What makes this clinic so cool is that it's a hybrid venture between the Roseman Dental School and the Cure for the Kids Foundation, which is, as many of you on Facebook right now will know, is a organization here in Las Vegas that treats children with cancer, with bleeding disorders, and with some really big, difficult things going on in their lives. There are a number of barriers that these families and children face when it comes to dental care, everything from communication to the effects on their oral health of the systemic treatments that they're going through. And this clinic in Summerlin was specifically built by the dental school and by Cure for the Kids to try to help mitigate some of those barriers and make life easier and make health easier.
And obviously being located in the same building, there's coordinated care, correct?
Mm-hmm.
With Cure for the Kids?
That's one of the great things about the clinic. If I need to touch base with a physician about a treatment plan or a particular surgical need that we need to take care of, I don't need to send a letter or an email or even a phone call. I can literally walk down the hall and talk to the nursing staff, talk directly to the physician, and take care of business, get things sped up. It's wonderful.
Yeah, and the other thing I really admire is the fact that you're also serving the families of these patients, so they don't have to worry about their dental care while focusing also on their children who are battling other issues.
Right. I love that aspect of this clinic, Jason. It's Dr. Thacker mentioned a moment ago some of the unique things that Roseman is able to do because of the collaboration not only between dentists and medical specialists, but between dentists of different specialties. And as you're alluding to there, when a child might come into our clinic with cancer, I can take care of that child, Dr. Chen can take care of that child, but the rest of the family needs care too. And often that's really difficult because there's so much medical care going on in that whole family's life that we can make that easier because Dr. Thacker can take care of mom and dad at the same time. It's one visit for multiple members of the family. It's truly fantastic.
Truly a one-stop shop for those families, and it's amazing what you guys do over there. And obviously we provide pediatric care for anyone at Roseman Dental in Henderson, also served by Dr. Chen. I want to transition a little bit to Dr. Roberson. Many children, most obviously in their tween and teen years, receive orthodontic care or braces. At what age should children begin treatment, and what are some of the long-term dental and overall health benefits of straightening the teeth?
So the AAO, the American Association of Orthodontics, recommends that all children be screened by an orthodontist at the age of 7. And while we may not initiate treatment right then, it's good for us to be able to monitor and recognize whether any growth deficiencies, differences in the growth of the jaws is going to have an impact later on. You know, the overall dental health benefits, as Dr. Chen and Dr. Thacker and Cottam alluded to, is that when we straighten the teeth, it makes it easier for children, teens, and adults to brush properly, to floss properly. It puts the teeth in the correct position within the gums and bones so that the risk of periodontal disease later on is mitigated somewhat.
Very good. And then, obviously, you know, most people think about the traditional metal braces that we all know and probably love. But obviously, Roseman, there's more than just traditional braces, right?
There is. This day in orthodontic treatment, there's a number of different methods of treatment. You know, the tried and true traditional braces with the colors that children love. They can coordinate their colors to their school colors, to holiday colors, or they could just be creative and pick whatever it is that they'd like to see together. And sometimes they match, sometimes they don't, but it's each individual or each children's individualism which allows them to kind of express themselves through their braces. Other treatments that we offer through the clinic are clear aligner therapy, things such as Invisalign. And one of the newest techniques that we offer is inside the teeth, a lingual braces system called Brava. And what this is it's a system that instead of braces being on the outside of the teeth where everybody can see them, these are cemented on the inside of the teeth. And so they're doing what they would do on the outer surface of the teeth, but on the inside where nobody can see that you're getting treatment performed.
Cool. And then
Truly invisible.
yeah, it's amazing because some people, particularly adult patients, don't want to have the traditional metal braces, and even some teens.
Not just because they see the braces, but it's everything that gets caught in the braces when they're out to dinner, the broccoli and all that food stuff.
Without proper dental care, could lead to decay. For the children that come in around age 7, two-phase, I've had number of children myself go through the clinic. So I talk a little bit about the phasing. I know my kids have had expanders in phase 1, and they take a break, they lose some more teeth, and then they get the braces. So talk a little bit about that approach with the 7-year-olds that come in for a screening and when they start.
Certainly. So two-phase treatment is kind of a little bit now and a little bit later. When children come in at 7, certainly they don't have all their adult teeth, and so we're not able to take care of everything. But as I said, they're in a growth phase. We're able to correct things not only within the teeth, but within the bones of the skeleton as they're growing. What it allows us to do is to change something that may wind up being a very temporary situation at a young age, transform into a permanent situation at a later age as the growth accommodates the movements of the mouth. We do expansion to make sure that we have enough room for all the teeth, to make sure that the relationships of the jaws in a forward-backward position, in a width position is correct. And after this treatment usually takes about 12 months, and we put them in retainers after that treatment, watch them until the rest of their adult teeth come in at 12, 13, maybe 14 years old, when we determine whether that second phase, also a shorter type of treatment, would be necessary. Sometimes it isn't. All the teeth come in a fairly good position, and the children wind up only having to go through treatment once at a very short amount of time.
Very good. Seems very efficient.
It is.
And I do want to add that one thing that a lot of people don't realize is that for many of us, when we were young, when we go to the orthodontist at age 12 or 13, for those of us who are very, very crowded, oftentimes the only option is to pull out a bunch of permanent teeth. And by going to see an orthodontist such as Dr. Roberson at an earlier time, we're able to prevent a lot of permanent teeth extractions. The options for treatment really expands.
And I'm sure children appreciate not having a bunch of teeth yanked out.
Absolutely, and parents too.
Yeah,
And
there's a
orthodontists,
cost.
too.
There's a cost
Yes.
with that as
Yeah,
well. So, but
Dr.
that's
Chen, was that a pun about the treatment options expanding?
Yes.
As we expand the
Good
jobs.
one.
very good. Dr. Chen, actually going back to you, we also have to send all those kids to a dentist to be cleared before they go through orthodontic treatment. Providing dental care to children, including those at the Summerlin Clinic, they all require a special approach because there's a lot of fear involved with children going to the dentist, right? Share how you take care of some of that anxiety and put children at comfort when they come to the dentist.
Behavior management and putting kids at ease, that is truly my biggest passion of being in the field of pediatric dentistry. We have dozens and dozens of special techniques that we use to alleviate fear. One of my favorite techniques is called Tao Shou Do, and if I can have that little puppet, I'm actually going to show you.
Artuthosaurus.
Yeah. So for young children, let's say I'm going to put a toothbrush or any kind of instrument in their mouth. So it's a 3-step process. Instead of just jamming something into their mouth straight, I would, number one, show them what it is. So let's take a look at this little toothbrush, and then I would let them feel it. Sometimes I would show the instrument, tap it on their finger, let them hold on to it, look at it, from all around. And then we show how it works. So if I have something that looks kind of pokey, like the little Explorer tool that we use when we check teeth, I would actually count their fingers. I might count their ears, count their eyes, and use it to touch their nose a little bit. And then we do the actual procedure. I would put the instrument in their mouth. So again, it's called Tao Shou Do, and I use that technique on almost every single young child under age 3.
Very good. For many people, fear is number one among children, but even adults, fear is big. But another one is the cost of dental care. That can be a barrier for receiving treatment, and that obviously can result in more costly emergency care when problems become bigger than they should be. So, Dr. Thacker, can you share with us how Roseman Dental tries to make dental care affordable for families?
Absolutely. So if I can see the dinosaur right there. No, I'm just kidding. That won't help. That usually is not going to help with the cost, unfortunately, as cute as he is. So at Roseman, because of some of our strategic relationships with suppliers, distributors, labs, we're able to offer dental care at a significantly reduced cost, generally around 50%. Less than what you'd see even in a private practice. And with that, even though there might be the assumption that there's a reduced quality of care, it's actually quite the opposite. Everything that we use is top of the line. We use the highest quality material, and better yet, we have no financial incentive really other than to provide high quality care for our patients. We take pretty much every single insurance that's out there, including Medicaid. And we're currently accepting new patients at our Henderson and Summerlin locations. So,
very good. And Dr. Roberson, orthodontics, that can be expensive for a lot of families. Tell us a little bit about the cost of orthodontic care at the orthodontic clinic in Henderson.
Well, orthodontics is probably the second thing parents think about when they find out that they're having a child is, 7, 8 years down the road, how am I going to be able to afford this? And we at Roseman feel your pain and are working with the residents, with the faculty, with the university itself to offer orthodontic treatment at a significantly reduced rate. Our full treatment fee, which is what an average teenager or adult would require, is $29.95, but even better than that, probably the best fee in the valley for comprehensive full aligner Invisalign treatment at $34.95.
Wow,
So-
that's very very affordable, and insurance is accepted.
Insurance is accepted. It doesn't change any of the fees. Our fees are based on a cash patient, but if you have insurance, that will contribute toward the overall cost and the patient portion is reduced as a percentage of what the insurance covers.
Very good. Dr. Roberson, there is another thing that you actually provide at the orthodontic clinic where payment can be quite a challenge sometimes. Can you tell us a little bit about the very highly specialized work that you do with a team of physicians in town to help children born with cleft palate?
Certainly. So in coordination with the Southern Nevada Craniofacial team, we at Roseman provide infant treatment for cleft lip and palate. And this treatment is called nasoalveolar molding, and it begins at approximately 1 to 2 weeks of age. We first get the impression of the child in the hospital with the plastic surgeon, Dr. John Menezes, and we perform the treatment at our facility in Henderson. What it does is when children are born with a cleft lip and or palate, the facial features are separated due to the cleft. And so what we do at Roseman with the nasoalveolar molding, or NAM, is to approximate the soft tissues and the hard tissues so that when the child is ready for the repair by the plastic surgeon of the lip and the nose, the repair can be performed with much better results because the tissue segments align with one another. They can be repaired with much better long-term results because we're not introducing as much scar tissue, which over time is going to impact the growth of the bones. And so these children, we're basically bringing them back almost to where a child without a cleft lip or palate would be at that same age.
And how many children have you helped over the years? I know you've been doing this for quite a long time.
Yeah, I would say, we're probably upwards of 80 to 90 patients. And while that doesn't seem a lot, off the surface, we have to think about how many children are born with cleft lip and palate, each year, and the significance of that. And so, we are seeing a good number of those children to be able to perform this procedure and, help in their long-term health, in their long-term dental care, and in their long-term life in general. I mean, the reality is how we look is going to impact, certain facets of our lives. Children, can be pretty cruel to other children, not recognizing what is going on with them. And so the more that we can do for these children to just allow them to develop that self-esteem that, is just going to help them in leaps and bounds later on.
Yes, I've seen some cases that you've done that have been absolutely amazing, and those children, it definitely would change their lives to have that fixed. And same goes with Dr. Cottom. Your treatment of patients with cancer, can you share a little bit about how that has benefited some of your patients' lives or their families?
Sure. Cancer therapy has a lot of side effects. And these can range from everything from the side effects of the cancer drugs themselves to side effects of just socially or psychologically what it is like to undergo cancer therapy. And the side effects can be surprisingly destructive on a patient's oral health. So for example, the cancer medicines themselves may affect the environment inside the mouth. They may decrease the amount or the quality of the saliva that you're secreting. They may cause inflammation on the cheeks and lips and gums that make it extraordinarily uncomfortable to eat, let alone brush your teeth. When those kinds of things start happening, there needs to be a support system already in place where the parent can and the child can get some advice and some help navigating these really difficult issues. On the other side, where it might not be the medicine's fault, cancer treatment's just hard, right? And that's going to change a lot of things inside the family dynamic, even what kinds of food we're eating, or how often a child might be getting a treat, right? We as parents want to help our kids be happy, and one of the easy ways to do that, I have young children myself, is to give them something sweet that they really like to eat. And that's something that helps you get through the day sometimes. When that happens too often, though, you're achieving the one goal of helping the child be happy, but again can be very destructive for dental health. And so a lot of the therapy that we do is preventive in nature, helping families, equipping families with the tools in advance to mitigate and navigate some of these really challenging issues.
And I think what you guys talk about related to what they're doing at a young age has impacts on them when they grow older and they, are getting into relationships or looking for a job. The state of their teeth, very important. It's one of the first things you see, correct? So, very good. I will turn to some additional questions. Implants. Roseman University offers implants for patients?
We do, absolutely, dental implants. We offer a very wide range of treatments. With implants, the technology's just come so far that it's an amazing option, not only for single tooth replacement, multi-tooth replacement, all the way to retention for existing dentures. So if anybody out there has lower dentures, you know how awful they are, honestly. And beyond that as well, we also offer all-on-X treatment, fixed hybrids, where we replace the entire dentition with implants, and at a significantly reduced cost, like we said. And the implants we're replacing are highest quality as well. So come on down.
Very good. What are some of the most common dental issues the clinic is receiving? Is it just routine, or are we seeing some extreme cases of?
Well, I mean, with kind of where society is now, at least in the last 15 to 20 years, one of the biggest dental issues that we've seen that has been on the rise recently, even in younger patients, when I was in the military, our patients who were 17, 18, 19 years old, is bruxism, which is basically teeth grinding. It's a habitual action, essentially, that is the teeth grinding together. It's related to a lot of things. The biggest one now is stress. So I'm seeing a lot of that lately. Yeah.
More so out of the pandemic, I would say. We see it even in our teenage population embraces.
Yeah.
Everybody's stressed,
The
whether it
pandemic.
was being quarantined at home or, virtual schooling, and, things are easing up a little bit, I think, but you still ask kids, are you stressed? And
Yeah, and when they see the scary puppets like that, they grind their teeth a little bit more sometimes. So,
Well, we got a comment on Facebook from Carson that the Toothosaurus is cute. So,
Okay, good.
So
Thank
that's
you,
a good thing.
Carson. And I
Carson's
want
right,
to.
Dr.
Yeah.
you're going to back me up here, Dr. Roberson?
I agree. I would agree with them. Yeah. You're on your
Can we
own.
do a Facebook poll after this or something? Facebook does that, right?
Yes.
I do want to add that in pediatric dentistry, in addition to diagnosing and looking for dental decay, for very young children, we also look at the airway. So we look for signs and symptoms of possible airway obstructions, sleep apnea, tongue tie, lip tie, the ability for a parent to breastfeed. Those are all little issues that a lot of people don't think about.
Yeah, indeed. Yeah, I didn't even think of them. So, yeah. I actually have a question on Facebook for Dr. Roberson regarding the Brava.
Okay.
The question is it safe? Could you maybe expand upon that a little bit?
So Brava, if you think about how we would put braces on the outside of the teeth and the wires and the rubber bands, all of that is on the inside. And so the same techniques are utilized as far as isolation to get the best bonding surface so that when we glue them in, there's low levels of any bracket breakage. The wires, they're unique in that it's not one wire that goes all the way around and connects tooth to tooth. It's almost like this U-shaped piece of metal that has what Brava kind of calls little tentacles that go out individually to each of the teeth and move the teeth independently of one another. And so, we can move one tooth, we can move all the teeth in an arch. But as far as safety goes, it is just as safe. It is, miles beyond in terms of aesthetic quality. And the patients really love it. It's relatively new, and it's something that they're going to be seeing more of. And we are fortunate to be working with Brava to be able to offer it to our patients at Roseman.
Yeah, and I believe the Roseman Dental website actually has a page dedicated to
We do, yes.
to the Brava, so audience can go and take a look, and that's at rosemandental.com, and click on Henderson and go into orthodontics, and you'll be able to see an entire page dedicated to what it looks like and how it works.
Correct.
Yeah, very good. I want to thank you all, Dr. Cottom, Thacker, Chen, Roberson, for joining us this afternoon. And thank you to everyone who joined us online. For information, as I mentioned before, about our Roseman Dental Clinics, including the one in Summerlin for Cure for the Kids, as well as Henderson for adult and pediatric patients, as well as orthodontics, including how to make an appointment, I invite you to visit rosemandental.com. Be sure to follow also Roseman Dental Ortho NV on Facebook and Instagram for the latest information about what's going on at the clinics. Big thanks goes out to the team at Cure for the Kids who helped us put this together. They made this event possible. Mitch Caloris, Jordan Garcia, Nick Strom, thank you very much. To everyone out there on Facebook, thank you for giving or joining us and giving us your time, and have a great evening.